Okay, so today we will um, discuss the examination of the ninth and 10th cranial nerve. As we know that the ninth cranial nerve is the glossopharyngeal nerve and 10th cranial nerve is the vagus nerve, and these two nerves actually make a plexus, pharyngeal plexus, and they supply the muscles of the pharynx. So that is why they have some common tests such as the palatal reflex, and this is why we are discussing these nerves together. Okay, so the glossopharyngeal nerve, which is the ninth cranial nerve, it is actually a mixed nerve. It has both motor and the sensory fibers as well as secretomotor fibers. Um, it arises from the um, elongated nucleus in the wall of the fourth ventricles. Taste fibers, they supply the posterior one third of the tongue, and the taste which is carried, taste sensation which are carried by these fibers are the bitter taste sensation. Motor fibers supply the stylopharyngeus muscle, which help in the swallowing, and the secretomotor fibers supply the parotid glands. Let us now. So let's begin with the testing of this nerve. To test the taste sensation, we need solution of a bitter substance, and we will ask the subject to close his eyes and place the solution on the posterior one third of the tongue on each side, and we'll ask him to identify what sensation he had perceived. Okay, so for gag reflex, nasopharyngeal sensation are checked by the gag reflex. Okay. To elicit the gag reflex, we will ask the subject to open his mouth, and his tongue is depressed by a tongue depressor. This is the tongue depressor. Posterior pharyngeal wall will then be touched with a sterile cotton probe on each side, and the contraction of the pharyngeal muscles will be observed. Contraction of the pharyngeal muscles are identified by the movement of the palate. However, the uvula does not move and it remains in the midline. Palatal reflex is elicited when soft palate is touched on either side, and it is observed that there is upward movement of the soft palate. If there is lesion of the ninth cranial nerve, the uvula deviates to the healthier side because of the pull of the normal healthy muscles. There is also loss of sensation in the pharynx, tonsil fossas, and the posterior tongue. And lastly, the carotid sinus reflex. Carotids, because the glossopharyngeal nerve also supplies the carotid sinuses. Carotid sinus reflex is elicited by pressing or massaging the carotid sinuses, and the slowing of the heart rate or the bradycardia is observed. But the carotid sinus reflex is not performed for physiological practicals because it can be harmful for the subject. The gag reflex is also obsolete now. It is not performed, but here we will perform it. So let's go to the subject and perform these tests. So the subject, so we should approach the subject from the right side. Assalamu alaikum. आप अपना मास्क नीचे कर सकते हैं? ठीक है। अच्छा, मैंने आपका जो मुंह का मुआयना करना है, ज़ुबान का और हलक का, ठीक है। आप उम्मीद है आप मेरे साथ ताउन करेंगे, आपको किसी किस्म की उसमें तकलीफ़ नहीं होगी। अगर कोई प्रॉब्लम होगा आप मुझे इशारा कर दें, मैं उसी वक्त रुक जाऊँगा, ठीक है। आप अपना मास्क मेहरबानी करके नीचे कर लें, ठीक है। सो वी नीड अ टॉर्च। सबसे पहले आपके मुंह में मैं टॉर्च डाल के चेक करूँगा। अपना मुंह खोलें, ओके। And then we will need with the help of tongue depressor, we will depress his tongue with the torch in his mouth. आपकी ज़ुबान को मैं नीचे depress his tongue and um, with the help of the cotton probe touch the posterior pharyngeal wall, and we will observe the contraction of the posterior pharyngeal wall and the movement of the uvula. To examine the sensory part of glossopharyngeal nerve, we will ask the subject to close his eyes, and we will put the drops of bitter solution over his posterior part of the tongue with the help of a dropper on either side. अच्छा, अब आपने अपना आंखें बंद करके बल्कि अपना मुंह खोलना है और मुझे आपने बताना है कि आपको किस किस्म का जायका आया है और कहाँ पे आया है, ज़ुबान के अगले हिस्से पे या पिछले हिस्से पे, ठीक है। मुंह खोलें। हाँ जी, क्या महसूस हुआ है और कहाँ पे?
कड़वा महसूस हो रहा है आगे वाले से।
जी, क्या महसूस हो रहा है?
कड़वा महसूस हो रहा है पीछे वाले हिस्से में।
ओके, and check the left side again with the help of dropper. So in this way we'll check the posterior third of the tongue. शुक्रिया, उम्मीद है आपको कोई मसला नहीं हुआ होगा। Vagus nerve is a 10th cranial nerve. It is also a mixed nerve, and it is the major supply for the parasympathetic nervous system to the most organs of the body. It supplies the muscles of heart, GIT, and respiratory tract, the smooth muscles, and it also supplies the voluntary skeletal muscles of the pharynx, larynx, and the soft palate. It carries the sensory fibers from the viscera. To test the vagus nerve, as the nerve form the pharyngeal plexus along with the glossopharyngeal nerve, so the common test will be the palatal reflex, as we demonstrated earlier. Another test is the R test. We will ask the subject to open his mouth and say ah, and we will observe the movement of the uvula. In case of Leon, the uvula will move towards the healthier side. Other tests include swallowing test. We will ask the subject to drink water, and we will observe any dysphagia or any regurgitation of the water. We'll ask him to we'll observe his speech when we will greet him and take consent from him, and we can also ask him to say specific words such as egg, which in case of vagus nerve lesion can have nasal tone, such as he will not be able to pronounce egg, he will pronounce eng, like nasal tone will be added. Finally, the laryngoscopy can be done to examine the vocal cords, but we will not perform laryngoscopy here. So let's proceed. So we will demonstrate the aha reflex. For that we need the torch. ओके, आपने मुंह खोलना है और आ बोलना है ज़ोर से। दोबारा बोलें।
हाँ,
ज़ुबान बाहर निकाल के आपने आ बोल।
हाँ,
ठीक है। So we observe the movement of the uvula,
sorry.
and uvula was in the midline. Okay, we will ask him to um, take sips from the water. From पानी पी सकते हैं. And we will observe the swallowing and movement of the neck muscles and any regurgitation. ठीक है जी, शुक्रिया. आप बोल सकते हैं, बोलें एग.
Egg.
ठीक है, चलें, शुक्रिया आपका बहुत बहुत. थैंक यू सो मच.
Thank you.
So these are the tests which are used for the examination of the vagus nerve. Vagus nerve also supplies the